Hello, this is Dr. Robert Zehr introducing a video on the concepts of an Orthopedic Center of Excellence. The essence of our center is founded in the collaborative efforts of many healthcare providers, including surgeon, nurses, physical therapists, hospital personnel, and outpatient caregivers, all working as a team to help each patient achieve the best possible outcomes for their surgical procedure. The patient is the center of all activities, starting in the physician's office with considerable preoperative instruction, continuing through the surgical procedure and hospital stay, and concluding when the patient returns to full normal activities such as walking, golfing, swimming, and driving. Sadly, the programs seen in this video that I developed and directed at the Cleveland Clinic Naples no longer exist, as this institution left Naples, Florida in 2006. Though this specific program is a lost legacy, what is truly most important to understand is that at the Zehr Center for Orthopedics, this same philosophy of professional cooperation, education, and dedication still exists, and each of our patients will benefit from the foundations created from this outstanding program. Please enjoy this vision of the recent past and know that I am working hard to reestablish an even better Center of Excellence for the future.
From the moment I had the surgery and the first step, there was no pain at all. The pain is entirely gone now.
I went from the walker to a cane within 2.5 days, and then I went back to work after a week and a half.
I suffered for a year. I was playing golf with a handicap flag, had the knee operated on, and now I'm back playing golf and I don't even need a handicap flag anymore. It's fantastic.
Cleveland Clinic, Florida in Naples is taking its already established commitment to providing high-quality specialized orthopedic care to a new level with the clinic's Orthopaedic Center of Excellence.
Orthopaedic Center of Excellence is a program that we've designed to empower patients to take active part in their treatment and ultimately their recovery.
The cornerstone of the Orthopaedic Center of Excellence is patient education. The entire team of dedicated orthopedic professionals in both the outpatient clinic and hospital is committed to helping patients become better informed about orthopedic care and participate more fully in their planned course of treatment. Patients undergoing joint replacement surgery begin a rapid recovery process where early mobilization, family involvement, and group interaction are integral to a successful outcome. This process, combined with the most technically advanced minimally invasive surgical techniques, affords patients the best opportunity for a quick return to activity with minimal pain.
In the last year, it's gone from not so good to not being able to function the way I like to. My golf game has deteriorated, so that was the motivating factor.
And this is considered end-stage arthritis.
John suffers from arthritis and is having a total hip replacement in just a few days.
I have a sister who's had both hips replaced, and I know her incisions are at least twice as long as what I expect to have.
What really helps is the Dr. Zehr, does an incision about this long, whereas other doctors it's about yay long, and I think that helps get healthy faster.
The education process begins from the moment a patient enters the center's outpatient waiting area. A large plasma TV continually shows informative videos on both surgical and non-surgical joint health and care. And once in the exam room, state-of-the-art audio-visual materials keep the flow of information readily available and accessible.
The idea is providing maximum input to the patient so that they can feel that they have a better understanding of their problem, and then we work together as a team to try to provide them with the best treatment plan for their individual problem.
Hi, Mr. Wooldridge.
Good morning.
How are you?
I'm just fine, and how are you?
Okay, so we're getting you all set up for surgery.
Right.
You have now become a member of the Joint Club. So I just want to go over the book with you about certain things that we do.
Once opting for surgery, each patient begins a preoperative education program that includes an orientation class and physical therapy. They also receive a personalized informational guidebook that outlines individual goals and explains every detail step by step so that they understand what to expect before, during, and after their joint replacement procedure. All pre-op and post-op appointments are scheduled at one time and are recorded in the guidebook.
It explains the problem, it explains the procedure they're going to use to correct the problem, it explains the exercises that you have to do to prepare yourself, and then also the exercises you'll be doing after the surgery to make sure that the process works and you get completely healed.
It was my Bible. I mean, every night I'd read it. I'd do the preoperative exercises. I followed it religiously after the operation.
Everything was well organized. The joint club was well organized. The rehabilitation was well organized. Everything went off like clockwork, step by step.
It was very helpful having the book. The book had a lot of good information in it, and it got us ready for what we had to do. And we knew we had to stick to our guns and do it, and we did it all, and that's why it's so successful.
Cleveland Clinic affectionately named the center the Joint Club because patients are treated like valued members of an exclusive golf club where they are the players and their family or loved ones become their caddies.
The caddies tend to be much like any kind of a coach where they keep pushing and inspiring people when they want to give up.
I like being a caddy because I'm the boss. I get to tell her what to do.
The golf theme is evident throughout the Joint Club and is used as a motivational tool during the recovery process. For example, golf flags are stationed around the orthopedics floor in the hospital to help patients measure how far they walk. The idea is to instill an element of fun to the experience.
I think that's a great theme. I mean, really, because 90% of the people that go into the operation are golfers, and all they want to do is get back on the golf. The first question you ask is, when can I play golf? That's your first question. And it worked out. It worked well, because I was back out playing golf within 6 weeks.
A large 18-hole golf course scoreboard is used to monitor each patient's daily walking progress and encourages a healthy competition among patients to be as active as possible.
You look at all the names on the board and see where they're at, and you just strive to be a little better. You want to be top dog, as they say.
It's an incentive. It keeps you going. You want to keep going. You think I wanted a 90-year-old woman to beat me down the hall?
And you won't see any hospital gowns in the Joint Club. When they get up, patients are given their very own Joint Club t-shirt and asked to get dressed in their own comfortable clothing. The reason? Just because you've had surgery doesn't mean you're sick.
Psychologically, going in your street clothes is a heck of a lot better than your hospital attire. And to me, you know, all of a sudden, my attitude was more positive than it was coming in here.
Just getting them up, getting them dressed, getting them in the chair for meals has made a tremendous difference in their motivation.
While in the hospital, patients receive a daily newsletter that informs them of the day's activities, including their group physical therapy sessions. Caddies are encouraged to attend the sessions to help train in the recovery process.
They love it. They love it. The caddies love it. The patients love it. We love it. It gets everyone together, forms a big support group. Everyone's going through the same things at the same time.
It was nice meeting the people and interfacing with them and sharing things. If I had a pain, I would review it with someone else and found out I'm not the only one with that pain.
We still are calling each other now to just see how the progress is going. And we're planning to get together and have a little pizza party. So we're going to keep together, and so these are the hip guys now.
They stay in touch, and you know, they form long-lasting relationships. It's wonderful to see.
We're going to meet for pizza and beer in about a month or so to celebrate.
It might sound like all fun and games, but the underlying goal of this innovative approach to orthopedics is no laughing matter. When patients are able to recover and share experiences, and when they're encouraged to take an active and informed role in their own recovery, it encourages quicker healing.
Healthy competition supported by a family members typically allows patients to get out of the hospital somewhere between 2 and 3 days, which is quite a bit quicker than days gone by.
I was in Costco on a Thursday about a month or two ago, and there was a man in there with a walker and had on a Joint Club t-shirt. And I asked him, I said, I can see that you didn't have knee surgery because he had shorts on. And I said, so I assume you had hip surgery. I said, when did you have it done? He said, Tuesday. And I said, well, this is Thursday. He said, yeah, 2 days ago. So that, I thought that was quite amazing.
We've set the program into motion so that they can expect to be back walking distances, riding their bikes, playing golf, and really building back up to what would be considered a normal life within 4 to 6 weeks. And that's pretty typical. That's not the exception.
I put off this operation for a year, which I'm sorry I did, because right after the operation, within 2 weeks, I was feeling much better. I'm back playing golf. No need of a handicap flag anymore. I could even go for a walk now every night after dinner, which is fantastic. The operation turned out fantastic.
John, also an avid golfer, has completed the pre-operative program, and on the morning of his hip replacement surgery, he's already looking forward to the outcome.
I'm quite pleased with what I've been explained. I'm looking forward to getting the job done.
In general, the trend in surgical treatments, not only in orthopedics but across the board, have been towards smaller and smaller incisions, on the premise that small incisions that disrupt less tissue hurt less, and less pain generally translates into a more rapid recovery. The benefit of smaller incisions and the whole rapid recovery is to overcome people's general fear or past knowledge that friends and family have taken 3 to 6 months to recover from these types of joint replacement surgeries. Now we have people literally up within an hour to 2 hours of returning from surgery. It's a big psychological boost for people to know that they will have a big operation and be immediately on their feet walking.
I was up almost an hour after the surgery and was walking around the floor with, of course, the help of a walker, and which I used for about 4 days, and then I have not used any support since that time. My sister's quite surprised. She's had both of her hips done before, and she was in awe of the fact that I was only on a walker for 4 days and the incision was only 2.5 or 3 inches long.
He had a very typical surgical procedure with a small incision, and he was up walking immediately after surgery, and I think that now 2 weeks out he's quite thrilled with his results. Looks good. You're not limping and you're not having any pain?
No, I'm not. I'm really quite surprised, and I'm very pleasantly surprised.
Within 2 weeks after surgery, John attended his first post-operative follow-up appointment with his surgeon and now is participating in outpatient physical therapy at the clinic.
That pain on the right side is 99% gone, so it appears though it worked out just like he said it would.
And what about the all-important question, when will John be back out on the green?
It's only been 2.5 weeks, and I obviously haven't played yet, although Dr. Zehr informed me I should be out chipping and putting starting tomorrow, which I will be doing. I can't say enough about how pleased I was with the service and, of course, obviously with the success of the operation.
Patients have thoroughly enjoyed their outcome, have said that they've greatly improved, and the feedback has been nothing short of extraordinary.
The program here, I feel, is terrific, and the care from the staff has been excellent. Very, very good.
Yeah, I'll vouch for that.
It was a very good experience. Cleveland Clinic is a beautiful place, and having a private room was rather nice. The nurses and the aides it was just a good experience.
Well, format is better than a dull old format. Get in the hospital, change your hospital gown, and sit in the doggone chair. You know, this is kind of nice.
And I would say that I would certainly come to the Cleveland Clinic. There's no doubt about that.
Now since the surgery, he's back playing golf, he's riding his bike and walking, which he never did before.
It's a first-class operation.
Patients have been really thrilled, as has the healthcare providing staff. The doctors, the nurses, the therapists have all been quite excited about what has been almost a revolutionary change in both attitude and outcome.
The Orthopaedic Center of Excellence is far more than just a place. It's a philosophy that inspires each member of the team to provide the best and most innovative care available to patients with orthopedic problems.